some breath.
The strain is being felt across the US, with 44 states reporting high or very high flu activity over the last week, according to the Centers for Disease Control and Prevention. It estimates there have been at least 8.7 million illnesses, 78,000 hospitalizations, and 4,500 deaths from influenza this season, and it's rising, with double the number of hospital admissions last week from the week before.
We used to see seasonalities with these viruses. We would see RSV, at least in our community, to emerge somewhere between October, November, and usually around December it would peak. And then we would see influenza emerge in January, and it would peak somewhere between January and February, sometimes into March. What we've been seeing now is that we have all these viruses, along with COVID, emerge all at the same time.
Children are particularly vulnerable. The CDC says 14 children have already died this flu season.
So you have a lot of children coming to our emergency rooms with these viruses, but also other respiratory viruses. So that means our emergency rooms are busier than ever.
Dr. Christensen says that's why vaccinations are so important.
We have vaccines that can prevent influenza, not only for children, but also in adults, right? At the same time, we have vaccines that can protect against COVID. So it's very important that everybody in a family cohort get vaccinated against these viruses. So if you had RSV, if you had influenza and COVID all at the same time, it puts quite a stress on healthcare systems.
The CDC is urging everyone to get vaccinated in a bid to prevent a tridemic this winter. Kate Fisher, CGTN, Washington.